Mayor Pete, thank you for staying with us. We've been talking obviously a lot about the response to COVID-19 on the local and federal level. I've been really disappointed in Mayor de Blasio's handling in the city. President Trump just said that the federal government is just backup for support of states' rights. You were obviously the mayor of South Bend for 8 years. Do you think the responsibility should fall on the shoulders of local government or the federal government?
I think what we're seeing right now is because of the failures in the White House, local government and state government are having to do most of the work. The president's remark sounds to me like a classic example of leading from behind. He's the president of the United States. If he wanted to, he could be leading the nation, leading the states, and leading the cities through these issues. Instead, that's not happening, although we've certainly seen some good work coming from places like the Centers for Disease Control, of course. When it comes to that political level and the president's level, we're not seeing what we need most, which is consistent, accurate information, stripped clean of politics, that we can all pay attention to and learn from, and support for those state and local officials who are on the front lines. What I will say is I've been so impressed by a great number of governors and mayors from both parties who have stepped up. I spent all of last year on the campaign trail preaching the importance of local leadership. We're seeing right now just how that leadership can kick in, and I think that's what's going to get us through this.
You're a man of faith. It's Whoopi. And churches in many towns and cities across the country have vowed to stay open despite serious health concerns. Now, I always thought you could talk to God from anywhere, but how do you feel about people saying, yeah, no, it's no big deal, come to church?
It just doesn't work that way. Look, this virus is irreligious. This virus does not have any respect for the fact that it may have crossed the threshold of a house of worship. If it infects you in a church, it is just as dangerous as if it infected you at a mall. That is why it is so important for people to stay home. It's hard. We're gearing up in my church community for Easter services that are going to be all virtual. And, of course, one of the best things about communities of faith is a chance to gather together physically. And there's a kind of exile from that's hard on everybody, but it is the right thing to do. And if you believe in protecting one another, if you believe in healing the sick, we all have a responsibility to do the right thing, even when that means staying right where we are.
Now, African Americans are being disproportionately affected by this virus, both in their communities and also even in prison. Dr. Fauci has compared it to the impact the HIV crisis had on the LGBTQ plus community. What do you think can be done at this point to help out the African American community?
The numbers are shocking. We are seeing a majority of those who aren't making it in places like Chicago and Detroit, I believe, who are African American, way out of proportion with their share of the population. It's not because the virus is discriminating. It's because of America discriminating. And all of these choices and forms of discrimination that have led to people having a higher likelihood of things like diabetes or heart disease, living in a food desert, or just not having had health insurance, all of which make you more vulnerable if you get infected. And I suspect also probably a higher proportion of black workers in professions where you don't get the option of coming in by Zoom and working from home. This is one more example of the patterns of inequality in our country that are being laid bare by what's going on with the virus. And it's why I'm glad that Dr. Fauci is intentional about this, and America has to be intentional, not just right now in the COVID response, paying attention, gathering the data, and looking at what we've got to do differently to support different communities, but also more broadly and systemically, making sure that we deal with these health inequities. We talked about it in the campaign. It's not going to get better on its own. And it's one more example of why we need federal leadership. It's one more example of what's at stake in the election in November.